Treatment cannot resolve muscular imbalance. Always remember that. You need to train the muscle. The weakness can only be overcome by... Alright guys, just on the topic of chronic pain, which trending on my Instagram as well as my other social media. ART helps with treatment of chronic pain. It helps with improving the slide, improving on the function of the muscles, because in ART philosophy, there's a lack of slide between muscles. It will result in mechanical failure resulting in pain. Usually caused by adhesions formed by muscle tension and stress. For example, if you are sitting posture and your arms are using without your arms, you're not sitting in an ergonomic chair, so you get a lot of tension in your traps, you get a lot of tension in your chest because of rounding over posture. You result in something called upper cross syndrome and you can neck pain. In this scenario I'm talking about, it is chronic pain. I'm not talking about acute pain. Acute pain is a different story. This pain comes in your neck because of prolonged sitting posture. And when there's tension build up in the muscles, there's a lack of oxygen going into those muscles, and this lack of oxygen going to muscles would stimulate the formation of scar tissues on the muscles. So this will result in a shortening of the muscles and it results in a muscular imbalance. Okay, for example, your head forward posture is because of a muscular imbalance between the anterior portion of our neck and the back of the neck and the posterior portion. So you'll get a cervical nerve impingement or a shoulder impingement because of the rounded forward posture. So this closes up the gap. For example, a rounded shoulder forward causes a protraction and elevation of the scapula, resulting in a rounded back, resulting in the closing up of the coraco-pectoral tunnel, or the gap between what we call the AC joint as well as the coracoid process. So the muscles underneath cannot slide, then you get impingement. That is what we call chronic pain, where there's a slow build-up of muscle tightness resulting in pain, be it a nerve pain or a muscular pain. You have pain. When it comes to treatment, especially in such cases, ART helps to improve muscle function, muscle slide. However, you still got to deal with the muscular imbalance, otherwise the pain is going to come back. So how do you deal with the muscular imbalance? Treatment cannot resolve muscular imbalance. Always remember that. You need to train the muscle to resolve the muscular imbalance, because weakness can only be overcome by strengthening, right? If the muscle is tight, you need to use stretching. Usually in the session that you come for, I'll teach the stretching. I'll also tell you of strategies to prevent the exacerbation of pain. For example, sitting posture, getting an ergonomic chair, some exercises that you can do in order to get your posture back. Strengthening is where it is required, where you need to be consistent, regular about it. I would often recommend you to my team to work with, be it once a week or twice a week, to learn the exercises and also to do the homework. So it's usually a three-pronged approach. Medication with the doctor, get from a doctor. Exercise program, you work with my team of trainers. And the treatment process, which I recommend only on an ad hoc basis, just to speed up the whole healing process. It cannot be done in a silo approach, cannot be done or just based on medication, it will never work. Just exercise also, it will take a long time because the tightness remains, and sometimes when the tightness remains, there's a hyperactivity will cause the other muscles to stop functioning. So the treatment is there to also help release the muscle, to prevent a contracture or to remove hyperactivity in the muscle. Definitely a three-pronged approach done concurrently. That's the best way to work, okay? There's no point signing up 10 sessions for treatment. The pain will never go away because usually a muscular imbalance or pain is involved. Thank you.